Hello, my name is Adriana Flores.
Hello, my name is Gloria Fry.
I'm Ariel Huerta.
I'm Diana Espinoza.
And I'm Quinn Brown.
We're Group 7, and our presentation is going to be on the elderly and mobility, specifically transportation within mobility.
In this presentation, we will be focusing on individuals who are 65 and over. According to the National Library of Medicine, mobility is defined as the ability for an individual to purposefully move about within their environment.
For the learning objectives, we said that upon viewing our group presentation, 80% of students will be able to list 3 transportation programs for the elderly, determine 4 barriers that limit elderly transportation, and identify the pros and cons to 3 assistive devices.
According to the CDC, cultural competence is defined as a set of congruent behaviors, attitudes, and policies that come together in a system, agency, or among professionals that enables effective work in cross-cultural situations. Cultural competence helps us understand different cultures within the elderly community. It is important to learn about the different cultures because it has been proven that health providers who are trained in showing cultural competence have a better chance at providing quality care and understanding for the elderly community. Many factors go into cultural competence, including race, class, gender, age, and language. For example, language barriers can result in not being well informed of the transportation services that are available. The elderly come from diverse communities and live all over the nation, either in rural, urban, and suburban areas. We should take into consideration that not all elderly people are the same. Many will struggle with mobility issues, mental issues, both or none of these. We cannot put blame on them for not getting medical help because transportation is sometimes limited to them. Elderly people will often feel a burden to family and friends and are less likely to ask for help. They strive to be independent, and this is a good thing, but it is always best to seek help when it is needed. As a society, we should steer away from ageist ideas that stigmatize elderly adults. When looking for transportation, the elderly are challenged by many barriers that will be explained further in this presentation.
Now we will get into the epidemiological data regarding the elderly and mobility. In 2016, the American Community Survey estimated the number of people in the U.S. aged 65 and older as 49.2 million. But due to the last of the baby boomers entering this age group, the U.S. Census Bureau is projecting older people to outnumber children. Because of this increase, there will be a higher amount of drivers aged 65 and older, as well as an increased number of people needing and using transportation services. In less than 2 decades, there will be 78 million people 65 years and older. The 2 most common disabilities for this group are ambulatory, for example, serious difficulty walking and climbing stairs, and independent living, which is a difficulty doing errands alone. 18% of seniors over 65 live in rural areas, 15% live in suburban areas, and 13% live in urban areas. On a daily basis, seniors make 3.4 trips. Of these seniors, 3/4 of them live in areas without public transit options, which means fewer bus routes. As people age, there is a heightened likelihood of medical or health impairments. The U.S. Census Bureau shows that almost 42% of people aged 65 and older have a disability. 9.5 million are reported as a physical disability, and 3.2 million are reported as a self-care disability. Of the disabled elderly, about 31.9% need specialized assistance to travel outside their home, and about 12% have difficulty getting the transportation.
We are now going to discuss the barriers the elderly face in relationship to mobility. Barriers include health crisis. Elderly adults who suffer from a stroke or a fall can limit their ability to move freely. Therefore, the lack of mobility is impaired, causing them to move more slowly. Poor mobility can lead to isolation, which can cause elderly adults to be lonely and depressed, which can lead to a sedentary lifestyle. Social relationships can reduce social network when elderly adults are restricted from establishing participation in community organizations, such as a religious service. Mobility constraints. Low-income elderly adults' ability to be aware of their surroundings diminishes over time. Therefore, elderly adults lose their independence and cannot afford commercial taxi or private paid transportation. Physical and functional health problems can pose a barrier when using public transportation if they are unable to walk due to chronic illness such as heart disease and diabetes. Unsafe neighborhood. This is a barrier because elderly adults have to worry about their safety. Not having safe sidewalks and signal lights that work effectively limit elderly adults' ability to go for a walk in their community. No access to mobility devices. The lack of mobility devices, such as a walker or a scooter, is a barrier that prevents elderly adults from leaving their home to participate in daily activities such as going to the grocery store. The elderly also face barriers in regards to transportation. These barriers include rescheduled or missed appointments. The elderly adults do not have reliable transportation. They have to reschedule their missed doctor's appointment, delay in their medical care, which can lead to increased need for emergency care and preventable hospitalization. Delay of care without reliable transportation, early adults cannot arrive to the doctor's office. Therefore, medication is not taken properly and patients cannot be seen by the doctor. Delayed medical care can affect an elderly adult's quality of life. Missed visits. Due to lack of transportation, there is an increase in the progression of the elderly's diseases, such as heart disease, cancer, and diabetes. Treatments can also be mismanaged. Elderly adults are limited to communicating with the physician regarding consequences due to poor care of chronic illnesses. Inability to drive can restrict an elderly adult from participating in daily activities, for example, going grocery shopping, and interacting with friends and family members. Mobility constraints reduce the elderly adult's ability to safely operate a motor vehicle in a safe manner. Elderly adults lose their sense of independence when they can no longer operate a vehicle, prevents them from the ability to move about in their community. Access to mobility resource. Low-income elderly adults cannot afford to pay for paratransit service or private transportation because they live on a fixed income. Social relationships. Elderly adults are unable to count on their family members to act as a form of reliable transportation because the family members are often occupied with activities such as work, taking children to school, and running errands.
There are 4 effective intervention programs that I will be discussing. The first one is GoGo Grandparent. GoGo Grandparent is a concierge service that connects seniors with on-demand ride services like Lyft and Uber. These services can have a car to location in minutes. GoGo Grandparent is best for seniors who are able to get in and out of a car without assistance. To use GoGo Grandparent, riders pay the regular price for the on-demand ride plus an additional 19 cents per mile for the concierge service. On-demand ride fares vary, but are generally lower than taxi rates. GoGo Grandparent is very simple to use. All you need is any touch-tone phone to call the toll-free number, which is 855-464-6872 to arrange a ride. Live operators are also available 24/7, and for safety purposes, rides are monitored and drivers are screened. Notifications about the ride are also available for family members through text message. Walkers and foldable wheelchairs are no problem. The second is Vail. Vail is a company that partners with insurance companies and health facilities to provide non-emergency medical transportation that's covered as an insurance benefit. Vail is best for seniors who need transportation to medical appointments and those who need a special vehicle to accommodate a wheelchair or stretcher. Vail is free if their insurance company offers Vail as a transportation benefit. All you would have to do is ask your older adult's insurance company if Vail is one of their transportation benefits. If yes, they'll help you schedule rides. Seniors and caregivers cannot sign up for the service or arrange rides. Only a health organization partner can arrange them. The third intervention is ITN America. ITN America is a national network of senior ride companies that offer door-to-door transportation. The number of locations is limited, but it's a great option if it's available in your older adults area. ITN America is best for seniors who need assistance in and out of the car and through the door to their destination. Price rates are affordable, but pricing varies depending on the local affiliate. To access ITN America, all you would have to do is contact local offices for more information and to schedule rides. A couple of local offices are Elder Help of San Diego, which is located in San Diego, California, and the second one is Whistle Stop, located in San Rafael, California. The last intervention I will be mentioning is Lyft. Lyft is a popular on-demand ride service that can have a car to your location within minutes. Lyft is best for independent seniors who are comfortable using smartphone apps and can get in and out of a car without assistance. The prices for Lyft varies, but it is generally lower than taxi rates. So, to use Lyft, all you would have to do is download and set up the Lyft app on your older adult smartphone. Use the app to book a ride and pay automatically by credit card when the ride is finished. Special service for seniors. There is a concierge service which requires no smartphone that is available through Lyft partners like assisted living communities, health organizations. All you'd have to do is ask local organizations if they partner with Lyft.
Assistive devices are used to improve mobility for people in order to perform particular tasks. Many people with disabilities utilize assistive devices to help them with their daily activities and helps them remain active as well. These aids also help alleviate pressure on one or both legs. Some of the types of assistive devices are canes, walkers, wheelchairs, and mobility scooters. Canes are used when a person has some sort of general disability. Canes are also used to improve disability as individuals move around. Having proper balance is needed to perform daily activities, and maintaining postural balance is important to inhibit physical damage to the person. Some risks associated with canes include the likelihood for slips and falls. The most common reason for falls is because of improper size for the person, which leads to misuse. Walkers are used for individuals who are unable to carry weight on their lower extremities. The legs of the walker provide extra support as individuals walk with it. The wheels also allows individuals to walk with a greater speed. Some disadvantages that walkers have is that they are less stable, and because of the wheels, it can be easily pushed away, causing individuals to fall. It is also not recommended to use for going up and down stairs.
Wheelchairs can be used for people who are unable to use their lower extremities. Individuals can opt to use a power chair because of its ease and convenience. It is good for those who don't have complete control of their hands and arms, as they are able to use the controller to maneuver.
Some disadvantages for the manual wheelchair is some individuals might not be physically able to move their chair on their own, or even have someone to push them. Some disadvantages for the power chair includes the inability to collapse or fold the chair, and some might not even have the vehicle to keep the power chair. The cost can also be a disadvantage as well. Mobile scooters allow individuals who are unable to walk to travel at a greater speed than wheelchairs. Scooters are able to move and maneuver quickly as well. Some scooters can even reach 15 miles per hour. Majority of them are able to use baskets, which allows individuals to carry small items. And mobile scooters can even prevent muscle strain and injuries. Disadvantages include the scooter needing maintenance. This includes replacing the battery. The scooter doesn't give the rider opportunities to exercise, and the scooter can also be expensive if insurance doesn't pay for the majority of it.
That concludes our presentation about elderly and mobility focused on transportation. These are our references, and thank you for watching.